by the way, for it being midnight also where you are and where I am. Thank you so much. We'll be starting in just a minute.
All right.
Give me a minute. Okay. So, welcome. Welcome again. Welcome to Medical Mondays with Dr. O, where we disseminate medical information and just have fun, enjoying ourselves by learning to better our health. Tonight, believe it or not, I'm zooming in from Nigeria. And our speaker, our own very own, one of Medical Mondays family, who has been one of Medical Mondays family almost from the beginning, Dr. Opeyemi, is also coming to us tonight from Nigeria. So we welcome you all to Medical Mondays with Dr. O. And we're starting today on dental health, dental care, as we promised a few weeks ago. So without much ado, I'm going to hand over to Dr. Opeyemi. The floor is yours.
Thank you very much, Ma, Dr. Ho, for giving me this opportunity once again. And I would like to appreciate your contribution efforts towards education on health. Is going a long way, doing a lot of wonders to people. Personally, I've been a beneficiary from this Medical Monday since it started. I've learned quite a lot of things that have enhanced my my practice. So thank you very much. And let me also thank you, congratulate you concerning your new appointment as a multicultural commissioner. That's a big position. So you are well done, ma. Thank you very much.
Thank you.
Once again, I appreciate every participant in this platform for some time. I appreciate Professor Adewole Ajagbe. Thank you, sir, for the opportunity. So without much ado, I want us to look at the issue of oral health again, specifically the periodontal diseases. Most of the time, most people don't familiar with the periodontal disease, but at least people know gum disease. So I'm going to, as much as possible, I'm going to use the common terms to, as much as possible, to explain things that I may have to explain. Now, the issue of periodontal disease, we want to look at the risk assessments. The periodontal or gum disease, basically, they are infections that affect the gum around the teeth. Now, there are basically two of them, actually. We have the first one, which is gingivitis, inflammation of the gum. This one is preventable, is reversible. That is, if the inflammation has occurred, we can still reverse it if proper care is taken, has taken place. But the deeper one, which is the big one, is the periodontitis. At this particular time, the infection or the inflammation has gone beyond the gum. It has gone deeper into the bone, destroying some of the tissues around the tooth. At that particular time, the inflammation has gone deeper. Thereby, the inflammation has opportunity to enter into the systemic circulation. Systemic circulation as in bloodstream. So it is very important for us to really know our risk of periodontal disease, because there are a lot of things going on now about these periodontal diseases. And it's amazing that quite a number of people don't even know that they have periodontal diseases, and it affects a majority of the population. So it's worth it for us to actually know our risks, whether we are low risk, medium, or high risk. Now, briefly, I just want to say that the problem or etiological factor for gum diseases is the plaque. The plaque is like the creamy substances that we usually see on the teeth surfaces. Maybe after we wake up from sleep, you see some creamy thing. They have bad smell, telling us that there are some bacteria that are inside those substances. Now, before they go to that stage, the initial bacteria that we have are very friendly bacteria. But as time goes on, interaction between these bacteria, you begin to see the more virulent bacteria penetrating this bacterial plaque and get into the deeper into the tooth surfaces. So at this particular time, they begin to, because they like an environment where there is no oxygen. So it's anywhere that is hidden is good for them, especially when it's below the gum line. So it's very, very important for us to know that this is the major reason why a lot of people are having these diseases. So anything that can aid, any characteristic that can aid or that can promote the aggregation or coming together of this bacterial plaque is what we refer to as risk factors. Anything that can aid, that can make the bacterial plaque to cause the periodontal disease is referred to as the risk factor. And we have to identify them as much as possible and ensure that we deal with them. Like I said, periodontal disease is beyond the issue of the tooth. We are talking of issue that has to do with all our bodies, because so long the inflammation has started, it gets to the blood circulation. Imagine the issue of blood circulation having bad chemicals traveling all around the body, from head, to toe, circling all around like that. So you will have what is called low grade of chronic inflammation. And like I said, the deeper the hole around the tooth, as a result of this virulent bacteria, the more burden, inflammatory burden we have from the periodontal diseases. Now, let me quickly talk about the factors that are actually responsible. We have some factors that are just within the mouth. Those factors are, we call them local factors. These factors may be position of the teeth. If the teeth are not well arranged, it will not allow individual to brush the teeth very well. And thereby it will be causing accumulation of this plaque. Another thing that can cause, maybe somebody is wearing braces, for example, he may not be able to effectively brush the teeth, because brushing of the teeth is the main thing that won't allow the periodontal plaque, this plaque, to settle. The more they settle, the more they allow the more the virulent one colonize them, and the more the greater the damage that they will cause around the tooth. So the local factors are those things that inside the mouth. And like I first mentioned, the issue of the position of the tooth, if the position is not well aligned, the issue of even the soft tissue, if there is a soft tissue that attach the lip, upper lip and lower lip to the base of the gum, this particular, we call it frenum. If the frenum is high, for example, it won't allow somebody to clean the teeth very well. So at this particular time, that is a risk factor for a local factor for that matter, that will allow bacteria and everything to settle in the plaque and continue. And you know, another thing about the issue of the plaque is that when the plaque grows big and enough, you have some calcium in the saliva being deposited in it to make it look like a cake. It becomes a hardening. And this is what we call tartar. All these things will allow much bacteria plaque to gather in the mouth. And the more we have those gathering, the more damage we have. And let me leave that and let's go into the more the issue of the systemic factors. Systemic factors have to do with the things that is happening in our body other than the mouth. The systemic factors, you know, for example, our issue of genetics. The genetics is what determines person A had a disease, while person B will not develop the same disease, despite the fact that they are exposed to the same substance or bacteria or infection at the same time. So, having said that, the systemic disease, the major culprit that we have in that one is diabetes mellitus. The burden of diabetes mellitus is increasing day after day now. Why? Because a lot of things are happening with diabetes mellitus. Diabetes mellitus, for example, it has a way of compromising or reducing the immune system, the immune capacity of the body to fight disease. Thereby, we have a lot of sugar in the blood that are not being used by the tissues of the body. And at the same time, they will lead to more, they make the cells in the body become lazy because they are not eating, they are not taking their glucose. And yet we have more glucose in the blood circulating the whole blood circulation. Like I said, let's picture a chronic inflammation as like a bad chemicals moving around the body. So the systemic factors are very, very important, something that we need to look at. And then after we have talked about, I just want us to look at the reason why it is important for us to know our risk. The first one is that it will help us to really know where do we belong. Ordinarily, in practice, we use some key factors to categorize people. This one is a low risk, high risk, medium risk, high risk. For anybody that has diabetes mellitus, for example, is a high risk patient for periodontitis. Another high risk is somebody that smokes cigarettes, somebody with persistent poor oral hygiene. You know, these are one of the things that make the periodontal risk of the person to be high. And like I said, if the pocket around the tooth that is formed as a result of those virulent bacteria is getting deeper, the more destruction, the more inflammation the person gets. Let's imagine the palm of my hand now. This palm, a palm of the hand of a man that has like a 6 pockets around his tooth, has infection that correlates to the palm of the surface area of the palm. So it's telling us that the inflammatory burden that one can have from one infection from periodontitis is high. So like I said, when we know our risk, it helps us to know how many times do we have to go for checkup. Some people may have to come for checkup every three months, depending on their risk. Some may have to go maybe once in a month, once or twice a year, depending on their risk. And also it helps us to know to reduce overestimation of disease. You have some people that the way they brush, they are destroying most of their teeth because they do over treatments. So I haven't said that the objective, like I mentioned, some of the factors that are very important for us to identify. Number one is age. I've mentioned some. I've mentioned the issue of DM. I mentioned the issue of tobacco smoking. There's something about tobacco. Tobacco has a way of it has a lot of things inside tobacco. As example, the nicotine has a way of impairing the immune system, causing destroying collagen that form the soft tissue around the tooth. So the other thing that are very important as a risk factor is stress. Yes, we have stress. Stress is part of daily life, but excessive stress is what we need to watch out for. And I mentioned the issue of genetic factors. Genetic factors, that one we cannot do much about it because the genetic factors we can't do much about it. But those genetics can be modified by the kind of environment that we live, or by the type of food or other substance that we are exposed to. The last thing about the factor is issue of pregnancy. We know that for pregnant women, because of the hormonal changes, they tend to have more prevalent incidence of gingivitis or periodontitis, as the case may be. Now, the other one is on the issue of cardiovascular diseases. Periodontitis, cardiovascular diseases, the two of them also has some things in common. Like for cardiovascular diseases now, this bacterial plaque that we have talked about, I don't want to be mentioning the name of the organisms. They found that they usually create something that are called plaque. We call it plaque, or something like a deposit on the wall of the blood vessels, on the heart. So it will thereby be limiting or reducing the blood flow on the heart, and thereby it also causes cardiovascular disease. I'm going to just, having said that, I just want to round up by discussing the issue of basic way of prevention. The basic way of prevention. Now, for every chronic disease, I've mentioned the issue of inflammation. Inflammation is what is responsible for most of the diseases that we have in the human body. Most of the time, it's not that inflammation initially is bad. Inflammation is part of the body to protect itself against some tissue injury, against some trauma and the like. But when the inflammation continues, persistent, because of the persistent infection as a result of bacteria or any other organism, it tends to persist and becomes a chronic chronic inflammation, thereby releasing more chemicals into the bloodstream. So our means of prevention actually has to do with understanding what are the things that will be increasing inflammation and what are the things that will be decreasing inflammation. Now, on things that increasing inflammation, that we have said, the issue of removing anything that we can do to be removing the plaque from the tooth surfaces. That is one of the major things, and that's where the issue of our blood toothbrushing comes in. Use a medium texture toothbrush as an adult. We have to use a medium texture toothbrush and look for use fluoride containing toothpaste, as the case may be. At the same time, we should endeavor to brush our tongue, because tongue can contain some hollows that can allow some bacteria also to hide. So some people brush their teeth, but they don't brush their tongue. Brushing the tongue is very, very important. Also, there are some in between teeth that bacteria tend to hide. So at this particular time, they won't be able to. Most people brush the teeth, but they don't brush in between teeth. So that's why we use dental. We have dental floss. We have we can also use water to rinse. You know, we use water to rinse immediately after we finish eating. Let's not forget, we want to reduce things that are pro-inflammatory, and this is the first step that we are talking about. And the use of dental floss, I've mentioned that, is for interdental, in between teeth. You know, at times our brush may not be able to get into that, but we can use dental floss to remove this bacteria plaque. And most of the time, I want to use this opportunity to discourage people from using toothpick, because it destroys the attachments, things that support the teeth eventually, and also create holes around teeth. The most common thing about the issue of pro-inflammation are things that I've mentioned before: all diseases, conditions, stress, everything that we can do to eliminate them. Smoking, alcohol, you know, we have to plan against them. So in planning against them, we look at anti-inflammation. The anti-inflammation, it can most of the time, the common weapon, and we have learned it on this platform on several occasions, is on the issue of diet. You are what you eat. So anti-inflammation, we have some food that we give us, we help us to fight inflammation. The legumes, the leaves, you know, vegetables. We have quite a number of nuts, these peanuts, walnuts. All these things, they help us to boost our immunity, help us to fight diseases. And I won't forget to mention the importance of supplements. Vitamin C, for example. Vitamin C is a very potent antioxidant that we need to consume as a supplement every day. It helps us to build the collagen around the teeth. It also it helps in wound healing. Vitamin D is also a very potent anti-inflammatory vitamin. It's very, very important. Apart from the fact that it supports the teeth and the bone, it also contributes to anti-inflammation. We have some wine, you know, that are very good. We can take time to take this, and fruits, like I've mentioned. Now, having done that, there are certain things that the professionals have to actually do. But I can bet you that if we observe carefully some of these little things, no matter how simple it sounds, we may reduce our visits to, may reduce our need of professional treatment, may be reduced anyway. But it is still important, because there are still some things that we may not be able to manage with as individuals. So we need the professionals to do some scaling of tartar in our teeth, removal of some of these bacteria below the gum line. We need to remove them. And also, if there are teeth that needed to be restored in function, we might need to professionals will help us to achieve this. So, like I said, things that we have, in rounding up, we should know our risk, as individuals. Periodontitis is not just a tooth, problem. Is a problem that can like, how do I a snake under a green grass, silently, and most of the time, because it is painless, the inflammation usually persists for long without person feeling any problem, until the teeth become shaking, until the tooth is lost. Oh, I've removed this tooth, until. So all these things gradually are very, very important for us to consider. I'm going to really stop here in case if there are questions, I may be able to go deeper. Sorry for some jargons that I must have used. As much as possible, I try to make it more to communicate it as much as possible. Thank you very much.
Thank you so much. We appreciate you. That was excellent. Actually, I don't think you use jargons. You explained to us in the beginning that periodontitis is a gum disease, and you interchanged that, and you spoke English to us. Thank you, because I understood it. I understood that the dental language, in English. I have questions. If you have any questions, you can raise your hand. But if you want to give me some work to do, you can put it in the chat box and I would ask for you. But I have questions. Okay. But before then, I want to thank you for stressing diet. It seems that everything we talk about bulges back down to good diet. What we put in our body, you said, is who we are. And so I want to remind us again to eat right, exercise, and because this affects every part of our body, the eyes, the teeth, the brain, all functions. So hopefully we'll do that. You said, though, that toothpicks are bad for us.
Yes.
There is toothpick that is, the wooden toothpick. And there is toothpick that is plastic, that is actually like a floss that you use after meals if you feel like something is stuck in between your teeth. Is that one bad also? Or is it just I don't know which toothpick exactly you're referring to. Or is it everything we stick in there after food when something gets stuck there that is bad?
Okay, all right. Thank you for that question, Ma. When we talk about toothpicks, there are a lot of designs. There are a lot of designs that we have. We have wooden stick, what we call wooden stick. If you look at the cross section of the tip, it's usually triangular. such that the tip, there's a way, if person apply it very well, there's a limit that it can get to in between teeth. It gets stuck to a level. Now, the orientation of when somebody is, if you are using toothpick, like longitudinally, vertically in relation to a particular tooth, definitely the person is encouraging the tissue around that place to be, to get compromised. But what I would suggest in removing teeth, or what I usually suggest, I advise my patient, use toothbrush. Use toothbrush, it works. But if your toothbrush cannot remove it, why not? You can use, so, but let it, because the habits that comes with use of toothpick is also one of the things that some people ignorantly, somehow they will develop that own, that pockets. And if they are, by virtue of their nature, they have the tendency to form periodontitis. It means they have already used their hand to initiate the process. Thank you, ma'am.
When you know how to do it.
You know, I'm still having a little bit of difficulty with that, just because we've been taught all the time to floss. Even in the dental clinics, my teeth get flossed, but it's not with the wooden one.
Yeah.
And so, you know, Dr. Jagwe, can you please weigh in on this for us?
Yeah.
You have flossed my teeth before with, you know, toothpick-like stuff. Oh, I think I may be getting what toothpick is wrong here. If you can please shed light. Thank you.
Thank you, Dr. Adewole, for the presentation. I know it's a very difficult topic to try and explain to a lay person without using big terminologies. However, I think the question Dr. O is asking is very straightforward. Let me quickly just go backwards. When I was growing up, it was a usual fixture for some people, some adults, to have broomsticks in their mouths, in the corner of their mouth. They are walking, they are talking, it's in their mouth. They are doing it all the time. They just poke everywhere possible with the broomstick. They keep going. Now, the problem with those people is they already...
I see Madam VP with the broomstick. I'm not kidding.
I know. I know what I'm saying. It's the usual fixture for many people. It actually is like a status symbol for them. But then what we found out over the years is that anyone who feels their gums itchy, if you feel your gum is itchy and you have to use toothpicks to scratch it or push the toothpicks in order to get relief, you are already in the area of periodontal disease, which is the deep gum disease. You're already there. So the only way you are doing it is by using the toothpicks the wrong way, which is what Dr. Adewole was trying to explain. Anytime you are forcing the toothpicks past the tip, which is very sharp, then you are actually tearing away the gum tissue from the tooth surface. And when you do that, it will not bounce back. Because not only do you have infection there, you are also using mechanical force to push the tissue away, and eventually the tissue there will shrink. Now, if you're talking to somebody and you look at their smile and you see this black triangle between the teeth, right around the lower third of the teeth, if you see a triangle that is black, you see black triangle all over, It means they have torn away the gum tissue that's supposed to be filling those spaces. Most of the time is because they've used toothpicks the wrong way. So if you are using the toothpick wrongly, you're gonna have, it's just a matter of time, your gum tissues are gonna be pushed away. Now, Dr. O, the question you asked about the type of toothpicks, there are different kinds of toothpicks, many different kinds, but the common cross-section that you will find is either circular, that is, if you cut across, it is circular. And there are some that are triangular, and there are some that are just flat. Now they are making plastic toothpicks. It used to be wooden toothpicks before. They made bamboo toothpicks now. Then they also have plastic toothpicks. Now there are new toothpicks that actually have a bowl with a dental floss, a very short dental floss. So it's like you have a bowl, and then you have the handle to the bowl, and then you can use it to floss your teeth. The problem with that is this: if you use one single of that dental floss to floss all your teeth, imagine you having a gum disease in one tooth, and you use the same floss to floss other places that are healthy. After you floss the the infected area, you have just spread the infection in your own mouth. Yeah. With just one dental floss, you have just spread the infection. So the best thing is, if you're going to be using that, you're not going to use only one at a time. You're going to use quite a few. And the manufacturers know exactly what that means. They will not explain it to you, but if you don't do it, one way or another, you're going to pay big bucks for it. If you use it wrongly, you're going to destroy your gums. And you end up with the dentist, and you may have to take out a few teeth, and you have to replace them. Each time you do that, it's costing you a lot of money. Now, those dental flosses are very good if you find the right ones. Not all of them are created equally. They may look the same, but they are different. If you use one, and as soon as you use it once or twice, the dental floss breaks off. It's useless to you. You can't use it. In fact, you have to use about 5 at a time in order for you to be able to get effective cleaning between your teeth. So those ones, if you use them properly, they will be very effective for keeping your oral hygiene very healthy. If you use them wrongly, you will destroy your own gums by yourself without anybody intervening. You will destroy it because you are spreading the infection from the bad part to the healthy part. So if you want to floss, know where there is no problem. You can start from there and then go walk your way to where it is bad. Don't go the other way around. Don't go from the really bad place to where it is supposed to be healthy. Yeah. So that's where I'm going to stop. If you still have any question about dental floss, there's a lot of information to pass on that.
Thank you, sir. That's great.
Thank you so much, sir. You know, I'm so sorry. I just want to be sure about this. There is that dental floss that is like a toothpick that comes with a single thread across this this plastic shaped structure. With that one, you cannot, I mean, it'd be crazy. They're not cheap either to use like 5 or 6 of them. They're very easy to use. You handle the bottom of it to just stick it in between to remove things that are stuck in your teeth after food. It's not every time that one has the time to go brush their teeth. And
I understand that, Dr. O.
Is that one good or bad?
That's what I just described. That's what I just described to you. if you use it properly, it's to your advantage. If you use it wrongly, it's going to be bad news. So if you just use it to remove, let's say you chewed oxtail. Oxtail has tendons and ligaments stuck between your teeth and you're uncomfortable. I told you, if you use one just to remove whatever is left over, there is no ground problem, right? That is okay. There is no problem. But if you use it once, and by the time you bring it out, it's already broken, you cannot reuse that on any other tooth. You have to change that. Even though you just picked it out, you have to pick another one to go to the other areas. Is that understandable, right? So if that is going on, just in a healthy environment, you can use one just to remove stuff between your teeth. But if you are doing it because you want to keep the spaces between your teeth clean, okay, and you already have gum infection, if you take one and you use it to clean all your spaces between all your teeth, what I've just explained to you is you will spread infection to areas that are not infected by using just one. Now, it may seem economical to you initially, but on the long run, it's going to cost you a lot of money. That's what I'm just saying.
Thank you. Got it. So there's a question here. Oh, I'm sure it still has to do with the topic. Madam CEO, Madam VP, you can unmute and ask your question. Unmute, ma'am.
Yeah, thank you so much. We got a problem. This toothpick thing. So, I mean, it's gonna take some time to change that habit, because there are some toothpick that maybe they're fooling us. That they say it has peppermint or menthol. That's the one I buy, the menthol toothpick.
You got it. They take your money.
You take your money. Come on, Dr. Adewole, make me feel good a little.
No, honestly, let's be honest with ourselves. The manufacturer, somebody's saying it back. Anyway, so am I the only one feedback? Sorry. Okay, Madam Lara.
Sorry about that. I've muted everybody. Sorry about that. Doctor, please unmute yourself. Sorry, I had to mute everybody for a minute. Yeah, go ahead.
Okay, so can you hear me? Okay, so if a manufacturer finds out there's intense competition, what would they use to draw people to themselves, to have a piece of the pie? They would do a little research or a big research, whatever. What do people really want? So for somebody like you who is willing to pay $20 for one little pack of toothpicks because it has a little bit of mint in it, well, they will be happy. They'll say, well, we have a piece of the pie. But how effective is it to you in controlling the diseases that may plague you if you didn't do anything else? So that's the question you have to ask yourself and know whether your money is being invested rightly or wrongly. For instance, I tell people it is not how expensive the device is, it is how effective the use of the device is. So people who use the Nigerian broomsticks, because for the Americans in our midst, we're not talking about the big broomstick, the one that is as thick as my arm. No, that's not what we're talking about. These ones are fine sticks, the veins of palm fronds that are broken into small pieces. They are very resilient. They seem to be like bamboo, but they are not bamboo because they're very flexible. You can bend them before they can, it takes a while for them to break, but eventually they do break. However, if you use that, it costs you nothing. It's free. But if you don't use it properly, it can damage your gums. All right. If you bought the one that has peppermint and you don't use it properly, it will still damage your gums. So you have to know how to use it properly. And unfortunately, you cannot go to a dental office and say, teach me how to use a toothpick. I mean, because in the scheme of things, that would not be what you want to complain about. However, to make you feel good, if you use a minted or a toothpick that has mint on it, the only good thing it would do for you is to freshen your breath. It doesn't do any other thing. It doesn't kill bacteria, for instance. It doesn't, it will dislodge the plaque. If you have plaque there, you can use it. And like I said, there's so much to talk about cleaning between teeth because there's something we call the proxal brush. The proxal brush. It is like a tiny toothpick with brush bristles around it. We give that to patients who already have gum disease because nothing else seems to clean that area properly for them. But it's like toothpicks, but it has brush bristles, almost just like the toilet brush, except that it's a toothpick. So you can use it to clean in between, but those are the people who already have big gaps that they've created with another toothpick between their teeth. So let me not belabor that, but if there's still any other, things to clarify about toothpicks, I'll be glad to talk about it. But it's a very important topic.
Thank you, sir. And, pardon me, you may hear a loud sound in my background. Electricity is out again in Nigeria. So it is somewhat the norm here. Dr. Maureen Booker, you have your hand raised. Dr. Opeyemi, be ready to answer that question. Dr. Booker.
Well, for one,
welcome, sis.
Yes, okay. Welcome back home. Enjoy Nigeria. Thank you for the episode. Two things. The speech was very good. Two things. I invited a friend, Cresta, to be on because she has periodontal disease. And two, what about washing your mouth with warm salt water to gargle? I heard that removes the plaques. That's what I was told. And I have that same floss that you talk about. It's a lot in the pack. I could show it to people on the forum. I have it upstairs.
Please get it ready and show it to us in a minute.
Okay.
Dr. Opeyemi, go ahead and answer the question.
Okay. Yeah, thank you, Ma, for that question. The issue with warm saline gargle is basically on the issue of the role that water plays. Now, the water tends to, of course, cleansing is part of what water we do normally. Even our saliva, our saliva has a cleansing action. Now, the salts inside the water create an environment that is not conducive for the bacteria. In a way, we call it a bacteriostatic, an environment that will not make the bacteria to be able to operate. So it's immortal. So the heat there tends to allow blood flow into the area. So when you use warm saline gargle, really, it's just that it will help to demobilize the bacteria. It may not really remove them because you are not supposed to take the water. It's supposed to just be for rinsing. Allow the water to go into the area that those pockets are. So it's very, very effective to a very great extent. In fact, it's effective, more effective than some funny mouth rinses. So it's very, very effective. In fact, 80% quite a number of people do respond well to it. But the issue is just that, number one, the way people do it is different. If you boil the water must be more fully, the water is boiled, and don't add another water to it, because if you add another water, indirectly you are contaminating that water. So put it in a stainless cup. Okay, put the water in a stainless cup, allow it to cool down a little bit to what the skin can tolerate. Get a teaspoon, get a scoop of a teaspoon of salt, level it, not the full scoop. Put it inside that water, stir it, and allow it. By the time you take it, allow it to get to the area around the place whereby there are infections or pain, or as the case may be. So it's very, very effective. The only way there it may not be effective is when somebody has tooth sensitivity. At this particular time, this dentin, the tooth substance is already open because more structures have been destroyed. So it's very, very important to know that occasionally warm water with salt might even worsen it. But at the early stage of periodontal disease, warm water with salt may reduce the bacterial infection. But so long a tooth pocket has been created, that cannot be closed up again. So that hole is already there. So it means that the holes needs to be managed so that the bacteria there are not do not become more virulent to cause periodontal disease. I would just like to stop there. Yes, that's the toothpick that is very common. You know, oral health is a big business. That's the truth. A lot of people are really maximizing on the issue of what I call a behavioral consumer behaviors. And that's why you see that we see that it's very common. Everybody has oral diseases, whether you like it or not, gingivitis, periodontitis. So some of all these things, they know that people will go for them because it sells or it appeals to it seems to be reasonable, but at the same time, the habits that are there are what people don't really consider. Thank you.
Okay, I have a question.
Go ahead.
Okay, thank you. I'm Crystal. So I have two things. One is I do have periodontal disease. So what my dentist did is that they took off in the palate of the mouth, they took out some tissue and they closed in the palate. So the gum pocket was I guess reduced. So my question is there anything one can do naturally in terms of diet or anything at home to like grow back tissue?
Pardon? I think, okay. Can you repeat that statement?
So I said, one of the procedure I think is the periodontist did was that they took out tissue from the palate of the upper arch, and they closed up the tissue where there was like a gap in the lower, like the premolars and the molar. But is there anything one can do at home to regrow tissue if your tissue is already?
So she has periodontal disease, and
Okay.
she said the periodontist used tissue from the palate, so filling the tissue that was missing or that has been destroyed in that area where she had disease. She's asking if there are natural ways to grow this tissue back after they had been destroyed, so to say. Is that your question?
Yeah, because I'm seeing
correct?
Yeah, that's one of my questions. Yeah, is there anything one can do?
Is that your question?
Yeah, is there something that one can do in terms of, and if it's food or whatever it is, diet?
Okay, if I get you right.
He said, is there anything one can do in terms of food, lifestyle, what have you, to regrow tissue like that?
Okay, thank you, Ma, for that question. The issue of using a tissue from the palate to cover another site where the tooth structure has been lost. It's one of the common surgical procedures that are being done. Now, there are certain procedures that can regenerate tissue back, really. But the one that they did at the palate, there's a way they call it subepithelial connective tissue graft.
Yes.
You know, they use it they usually use it they avoid the the arteries at the palate and use it to cover. So as long as they use it to cover, that place will heal. It will heal on its own without any cover, because what they do is that they go in, took the tissue and now close up. That sub-epithelia, it's not on the surface of the palate. So they excise the palate, took the tissue, because that tissue, they found that it has good width that can replace the attached gingiva. Their gingiva is lost, so they need something to replace it. So that's that. But you can actually do they can do another procedure without even doing surgery. They can get there's what called acellular dermal matrix. They can use it to cover it. So there are many. If supports are lost, there are procedures to regenerate them. So the fact that somebody has a hole or teeth are shaking, that's not the end of the whole thing. There are still many procedures you can do to restore lost tissue. I don't.
Thank you. But is there any natural? Is there any natural way? Is there anything natural that one can do to, we've heard about flossing or, using toothpick, not to do it, but it can cause damage. Is there any natural thing one can do, though, to regrow tissue that is lost?
In the real sense of it, if a periodontal tissue is lost, there is little or nothing we want to do. It's better to prevent it being lost from being lost, other than trying to, because if it's lost, if you continue to gradually lose until the whole tooth just exfoliates. But when the person presents in a clinic on time, there can be some procedures that can be done to ensure that the tooth is preserved for some time, other than just go and extract the tooth. So naturally, there's no natural thing you can do. But there can be some, you can use some synthetic bone substitutes, because to replace some of the bones or whatever that are, this is part of the regenerative materials that we talk about. Something that look natural that can be used for some of regenerative procedure is plasma. When you talk of the frozen plasma, to generate some cells that will eventually replace the lost tissue. But this also is one of a very technical surgeries in the periodontics.
So the take home is that it's best to prevent than to allow. Once it happens, you cannot regenerate. So Alagba,
I have a question, Doctor.
Yes, Alagba. Pastor Michael Adekale, go ahead, sir.
Oh, thank you very much. And how are you doing in Nigeria?
Doing well. Electricity just went out, so generating system.
Oh my God! Yeah, that is Nigeria for you.
That's Nigeria. Welcome to reality.
Yeah, I just have a little question. I went to see my dentist today, and he wanted to perform the tooth implant. I would like to ask, at my age, is it advisable to do a tooth implant or to just leave the teeth, the area like that, and just because he was explaining to me that they have to put something down, the root of it has to go down into the bone, and that they have to measure it and do. He just gave me all the procedures that he was going to take. It was going to take in order to get it done, and I was a little bit skeptical and scared. So I'm glad we're on that topic tonight. So can you please advise me as to what to do?
Okay, all right. Thank you for that inquiry, sir.
Dr. Opeyemi, because
Yes,
Dr. Adewole is a tooth implant expert, if you want him to take that question, please.
okay.
Because he's an expert. That's one of his expertise.
Okay, all right, sir.
In there.
Okay, first of all, let's issue that disclaimer again. We are not establishing patient-doctor relationship when we discuss. We're just passing on information. So let it not be that somebody will come back and say, but you told me this is what I should do and this is what I shouldn't do. We don't know the full story of everybody's case, so we cannot truly give specific advice on many cases. So, but just to find out, there are two issues that I really wanted to comment on. The first one is the tissue graft. Yeah, there are different options. They don't, in fact, there are, analogous grafting that can be taken that are cultured, and they can actually buy it and use instead of your own tissue, which is compatible with your body, and your body will not reject it, and that's a potential approach. Now, if they've already done the graft from your palate, if there is an area that looks sore, if there is a sore area on the roof of your mouth, don't worry, it's going to heal, because usually whenever you have a cut in the lining of the mouth and the blood clot bridges the two edges, the cells will grow across the blood clot over time. So that will still heal. And you may never know that you have such graft done from your palate. So I wouldn't worry. The best thing to do is that you will keep the place clean. You will make sure the place is clean. You will use whatever they give you, chlorhexidine.
Dr. Adewole, you're breaking up for some reason. I don't know.
So if somebody's feeding, I don't know whose son is feeding back. But I don't have anything behind.
Sorry, I got it. So please, if you repeat what you said, sorry, I muted the person.
Okay, so what I'm saying to Cresta is that do not worry if you have anything like ulcer at the roof of your mouth, where they took the graft from, is going to heal, okay?
No, she doesn't. She was just asking, how is there a natural way to regrow tissue that had been destroyed? Dr. Adewole answered that. The question now is about the
regeneration naturally, right? So the question, actually, no, it didn't. It did very quickly. I do.
Okay. No, Dr. Adewole, hold on, sir. Go ahead, ma'am. Hold on, sir. Go ahead, ma'am.
It did hit very, very quickly, and that was A-okay. But I have a genetic condition which I've been for the past 7 years, where basically the calcium in the tooth gets reabsorbed into the body. So I'm under constant evaluation. So my teeth, my gum and everything appears healthy, but it's just constantly the calcium is being reabsorbed back into my body. So my teeth will be kind of shrinking constantly, and it's a very rare condition. So when they pick me up, it's like my vitamin D was like 3. And so every 3 months, they go behind the incisor, remove a little bit of microscopic tissue. They look for inflammation markers. After 7 years, the research more or less has come to an end. And my vitamin D is now like 65. and the inflammation markers have come all the way within the normal range, which is good. So far, everything seems to be stable. But I noticed there's another pocket coming in. So that's why I wanted to know if there's anything I can do supplementation-wise. But I probably have to speak to the endo or perio within the next month or two.
Well, okay. Well,
so Dr. Adewole, to reiterate, she doesn't have a sore. She's looking for ways to prevent continual periodontal disease, continual destruction of the tissues. And she was asking if there are natural ways to do that. She takes vitamin D. Her level is excellent at 65. And hopefully, you know, Dr. Adewole talked about vitamin C also, that, you know, that also would help. But specifically, if there is answer to natural ways to prevent or to the continual destruction of the tissue, that would be great.
Well, okay,
That's
so
what yeah. Please be specific. Thank you, sir.
all right, thank you for clarifying that. As you said before, when you lose bone from periodontal disease, that is one part of the body that does not forgive. That part of the body does not forgive the individual if there's a neglect. Whether it's a neglect is in the nutrition or is in the local care of the oral tissue. So somebody who has very poor oral hygiene, doesn't clean the mouth, doesn't floss, doesn't brush, when that person loses bone, the bone does not grow back. It is one part of the body, the bone does not grow back. If you lose it, it's gone. Now, you don't lose gum without losing bone. So if you begin to see the root of your teeth, it shows that you have lost bone and your gum tissue has shrunken down to the level of where the bone level is now. That's the reason. And
is
that's
there a way to prevent this going on, sir? Is there a way, is there any natural thing to prevent this going on?
To regrow is what she was asking. There is
no. She was not asking to regrow.
She's nodding. She's nodding. She wants to know how to regrow.
Okay, the bone will not regrow.
Exactly.
Is there a way to prevent further destruction? She says she has a genetic basis for this. Is there anything one can do? Go ahead, Dr. Adewole.
Okay, Adewole. Like I said, that's the reason why the issue of knowing one's risk come into play, because that was the first question I wanted to ask. That if you are having that experience, do you have any genetically related basis for it? Because if there are genetically associated reasons, it means that you might need to put eyes on. You have to be very strict on some of the practices that you do, the food that you eat, because the genetics is already there, but you want to do other things that won't favor the periodontitis. So that's all that I want to say there. You might need to make sure you keep your appointment visits. Make sure the food that you eat, don't eat too much of sugar. When you take more of antioxidants as much as possible, because this is a genetic thing. So, and it will always affect periodontitis no matter what you do, but you can limit the progression. You can limit by virtue of this maintaining all these safe practices and also visit. Not necessarily too much treatment, but just the simple practices. But when you now come to the the children that are unborn that have not, I mean, I'm talking to the children, you might need to also caution them, let them have an idea of the basic things that they need to do so that they won't come down with periodontal diseases, or even if they are going to come down with, maybe a very later in their lifetime. Thank you.
But right now, my gum is in a healthy condition. So the periodontal disease, as of the last 2 weeks, is like stable. It's fine. Has any of the this year come across a rare condition where your body reabsorbs the calcium in your teeth? Does any one of you know about that? Because I've been part of this research for like since 2007. It just more or less came to a close. And maybe, I guess when they picked me up, they probably saw something in my teeth that looks like maybe when you wear braces many times, maybe like little white dots on your teeth. So that's why they picked me up. So it may be like, they say, for every 2,000 people, they see one person with it. But from that, one of the things that came across was that what I wasn't aware of was that how low my vitamin was. But throughout the year, and maybe interestingly, because of maybe during COVID, I really upped my vitamin D. And now the inflammation markers seem to be okay. But I haven't found out everything as part of the research because I guess I have to print the paper. But I am just concerned. So that's one aspect, is this where your body reabsorbs your teeth technically, it just gets small. I do have all my teeth, but now I have crowns over my natural teeth because the teeth is just getting shorter and shorter. Can you give any advice?
Actually, I didn't hear the beginning of your question, but I think I
Well,
heard
wasn't
about
let me help.
use of vitamin D.
Let me help. She was saying that her teeth is in good condition now, as of 2 weeks
Now,
ago,
okay.
when she went to dental care. But she said she was asking if you have heard of the condition that causes calcium to be reabsorbed from the body, affecting the teeth, like did hers. Correct? She's nodding. That's the real question, really. Have you heard of that? Yes or no? Yes or no? Because I have lots of questions I want to ask.
Yes, I've heard of a condition whereby somebody is losing, in fact, the calcium level seems to be normal, but yet the person is having tooth mobility. You know, these are one of the cases that give us like is worrisome to manage. Yes, but I've heard of that kind of it's a systemic thing. It's not this that we don't have. It's not, you have to do some some investigation that are not routine, you know, and we don't have all those things. We don't have all those facilities. I've heard of those kind of conditions, but it's not, I don't know what will be responsible for that.
Thank you so much. I want to compliment you, Ms. Cresta, because it's obvious that you have been on top of this. You are doing the best you can, given the scenario. You are following up, you're doing what you're supposed to do, and your teeth is now in good condition. So from what we have learned tonight, if I'm wrong, correct me, please, you know, vitamin D, vitamin C, the oral health, you know, brushing the tongue, which, you know, there's a question, we're going to talk a little bit more about that because there's a question about that, you know, that we'll get to in a minute. So I think those are the things, but before the night is over, I'm sure you'll pick up some more things. So going back to Pastor Michael Adekale's question, Dr. Ajagbe, kindly answer the question on the implant. He's scheduled an implant and he wants to know if it's the right thing to do. He's been walked through the process. He just wants to know, should he do it or not?
Okay, the first question I'll ask is, you said at your age. What does that mean? What does that?
He's in his 60s.
Okay, so age really.
He's in his 60.
Okay, thank you. I don't think age has there's an age limit to when you could have an implant done. The factor that we look at is the health of the bone. The health of the bone where the implant is going to be placed. If the bone is very weak or very skinny or very thin, we can always pick those up on the x-ray. Now, if you are in the United States of America and they did what we call the CBCT, which is cone beam, computer tomography of your jaw, your dentist can actually see the volume of bone you have. So that by the time they are considering putting an implant, if it's
you were breaking off. We heard up to if your bone is thin.
Yeah, I said if the gentleman is in the United States of America and the dentist did what we call the CBCT scan.
Yes, he is.
Yes, I'm here in Chicago.
Did they do a CBCT scan of your jaw, or they just did?
They did it.
They showed you the 3-dimension look of your jaw, right?
Yes, and the doctor said, the dentist said everything looks fine, and that they can go ahead with the video.
Okay, so if it's on the lower jaw, I don't know where it is. If it's on the lower jaw, the concern that the dentist will have is how close is it, where the implant is going to end. How close will it be to the nerve inside the bone, inside the jawbone? If it's going to reach that point before they can have adequate amount of bone support, then many dentists will have to do a bone graft first and make sure the bone graft heals before they consider doing an implant. So if they told you that your bone is okay and it's on the lower jaw and it's not close to the nerve and the blood vessels, I think the success rate seems to be going higher in that case. So you expect to have a good outcome. But if the nerve is, if the bone is not big enough to take good size implant that can carry the weight of chewing, then it's not likely going to be successful. Even if they put an implant there and they put bone graft around the neck, it's not going to be successful, because the key is implanting in a very solid bone where if you move it, it's not going to move. You must have that solid foundation for the implant to be successful. So if all of that they consider and they said is good, well, I think if you can afford it, you should go for it.
Okay, thank you very much. Thank you.
So I have a follow-up question. If he doesn't do the implant, from what I learned before, the rest of the teeth will move, right?
Yes.
They will move and be disconfigured. Okay, go ahead, sir.
As people get older, the bone is not as strong as before. So if you lost some teeth prematurely and you do not replace it, and there is no balance, for instance, if you had crowding originally and you took a tooth out, now there is enough room for the other teeth to wiggle and kind of just move, what I would call by default, and try to occupy as much space as possible by spreading out. But if your teeth were normal in terms of spacing and you lost some teeth prematurely, the chances of the teeth migrating or tilting towards the space where the tooth is missing is very high. And in that case, the teeth will begin to drift. And usually, anytime you lose any tooth, the bone shrinks in that space and causes the teeth adjacent on either side of the space to lean towards each other like that. It's almost like they want to try to touch. Depending on how wide the space is, they may not be able to reach more than that. Otherwise, they will no longer be stable, because if they move so far, now you are biting on the side of the tooth, not on the, you have to bite on the top of the tooth in order for the tooth to be stable. Once the teeth have become tilted, the teeth will migrate in that direction. And eventually those two teeth will be lost, eventually. So it's better to replace a missing tooth if you have good bone. If you don't have good bone, well, you can replace it with dentures. Dentures may be removable, or you can put a fixed prosthodontics or fixed prosthesis, which is called bridge. You can put a bridge there and it will still serve the same purpose. So,
oh, really? So dentures, they have a single denture? I thought they were all like a set. So we can apply for that single one?
no, you can have a denture for one single missing tooth, or for that 28 missing teeth. So you can do.
Okay.
It depends on where the tooth is missing. If it's in the back, where you normally
the back, at the bottom, at the lower level, in the back.
Okay, so you have that, and you have some strong teeth on either side of the space, and you don't want to do the implant, or because you don't have the sufficient bone, you can actually use a denture. They can put a denture there that can span the space, and then you still be able to chew with it. The only thing is that you will have to be removing it to wash it and put it back in.
Okay. Thank you very much, sir. Thank you.
You're very welcome.
Thank you so much, sir. Appreciate that. So I want to go back to the questions in the chat box. Abby said she's still up in London. A school of thought says to brush the tongue. Another says not to. How far or how deep should you brush the tongue? Dr. Opeyemi. Dr. Adewole, go ahead.
Okay, thank you for that question. I usually explain the issue of logic to patients. The idea here is whether brushing of tongue or not brushing of tongue is the key. The issue is we are dealing with, we want to overcome the bacteria that can cause a future disease. And tongue, any tissue of the body, has potential to accommodate bacteria or any other disease. But what the particularly about tongue is that the tongue has a lot of crevices where these bacteria can hide. So brushing of the tongue is also a way of cleaning. Why, if somebody clean all the teeth and the tongue is still coated, it's like you're doing 50% of the job. As immediately the patient is off, the other bacteria, they colonize the teeth, colonize the teeth again. So it's important to brush the tongue at least as long as the person can tolerate it backwards, as in posteriorly. So there's no harm in brushing our tongue. There will even be more harm in not brushing, because that one will be causing bad breath and all sort of public psychosocial embarrassment. Thank you.
Actually, there are toothbrushes and there that have the tongue brush in the back of them. And, they don't go that tongue deep. You have the front part that brushes the teeth, and then the back of it is the tongue brush. So those are maybe good ones to purchase. So Dr. Ajay said, well done, Doc, for the presentation. Very well delivered in a brief moment. And I concur. Talking about Toothpick, please tell us what we should know about those who use chewing sticks and also charcoal users to clean their teeth. Thank you.
Okay, thank you for that question. You know, I thought it's only in Nigeria that the debate for chewing stick is still the issue of chewing stick has cut across, attract many interests. But the truth of the matter is that in our local setting here, some chewing stick has some ingredients that science community have found out that they are actually beneficial to the oral environment. However, brushes are like improvements of technology over the chewing stick, and so long the person can shoot the stick enough to get enough tufts. You know, this thing that look like tufts that can actually, is that tuft that we clean. So use of chewing stick is still, if somebody likes to use chewing stick, is okay. But I can assure you that a chewing stick cannot brush as enough as a toothbrush if used properly. But you can combine the two as much as we like it. So that's just what I have to say. Use of chewing stick is good because of certain elements, some micronutrients also within those chewing stick. They have antibacterial, anti-inflammatory properties also that are inherent in the chewing stick. However, some of all these ingredients are now incorporated into correct fluoride containing toothpaste that as soon as you put it in your brush, you are good to go. Thank you very much.
Thank you so much. Wow. So is it a bad thing to have spaces between teeth naturally? Attorney Williams wants to know that.
Well, naturally, our teeth are not meant to have spaces. I do see people, especially at the front teeth, when somebody is having, he said, what we call Yoruba, people usually call it a G, diastema. Some people use it as a sense of beauty and the likes. It's abnormal. It's abnormality as far as the dental community is concerned. Because the truth of the matter is that when you begin to have teeth, space in between teeth, there is tendency for movement of the teeth, depending on the location of that particular tooth. For example, the one that are anterior, at the front, those ones may not move like that. But if there are teeth at the back that have spaces, they tend to move towards the front. So by virtue of that moving, they tend to create maybe bending. They won't stand well again. And so long a tooth is not standing well, like I said during the presentation, positioning, it will create an environment that is good for bacterial plaque to be hiding. The person will not be able to clean that place very well. So it's very important for teeth closing spaces, but there are some things that you can't do to it. So long the person has a space, just ensure that you are cleaning that place very well. It will allow you to. There's no big deal about that. But it's of concern to me if that space is anterior, because the tongue will always play there and be pushing that tooth, and be pushing the tooth together until it comes to a time that you realize that the teeth may become shaking, and eventually that tooth is on its way out.
So anterior means in the front.
In the front,
right?
Yeah.
So if the tooth is in the front, then the tongue will be pushing against it until it comes out, you said. Okay, so got it. That though, I'm sorry, the light is out again and the gen is out for whatever reason. So pardon the the display on the screen. So what about those, we have in Africa, especially, there are people who have the gap in the front of their teeth, especially upper teeth. sometimes even on the bottom, and there's a name for it, and it is actually coveted in some areas. Are you referring to those also? Because that is natural. They were born like that. Their teeth were structured like that.
Yes, that's what I'm saying. There's nothing they want to do about it. They, in as much as what some people think is a artificial natural beauty, but what we are saying is that it is more preferable for the teeth, the spaces, especially at the front, to be closed. But if the person doesn't want to close it, no problem. So those natural things, there's nothing people want to do about it, because it's like a genetic inherit something that is familiar or inherited. So it's not a bad thing, but it will be a bad thing as time goes on, especially if that space is big. The space will continue to increase. The spaces will continue to increase. And like I said, one of the major player is the tongue. Tongue like to explore area that things hide or spaces. So it will just be going there. And tongue is a very powerful element. It may, with time, it may be 30 years later, 20 years later, the person will find out that the tooth has actually moved to an extent. So that is all I have to say about that.
May I say something about this?
All right.
Yes, sir. Go ahead, sir.
Okay. Now, this is an area that people have not done too many scientific study on. However, this is based on my own experience of 43 years of practice. I can tell you of a fact that anyone who has a median diastema, which we call a G in Yoruba, is a gap in the front between the front two upper teeth or the front two lower teeth. The problem is, you call it genetical, but it's developmental. Developmental from the standpoint that the frenum, Dr. Adewole mentioned frenum earlier when he was talking about the frenum is highly attached. The people are not able to brush clean around their teeth, and that could be one of the contributing factors to gum diseases. I can tell you, I don't want to embarrass anybody. If you have a gap, go in front of your mirror, pull your upper lip up. If you see that little attachment like a string coming to the space between your two front teeth, you have what is called a high frenum attachment. And as long as you have it in that position, every time you move your lip, it's causing the teeth to stay apart. The only way to manage that is to snip it, remove, relieve what we call the restructuring. You relieve that frenum and let the place heal, and then use a brace, whether removable or fixed braces, to bring the teeth back together. If you do braces with that attachment still in place, when you remove the braces, the spaces will come back. So whether it is on the top or the lower teeth, it is because of the way the frenulum is attached to the jawbone. So if you want to prove it to yourself, go in front of the mirror, just pull your lip, pull it up and look in the mirror. And if you can see that little thing in the middle that is attaching to the space between your two teeth, that space will continue to get larger as you use your lip. And then with time, Dr. Adewole mentioned it, the teeth may actually become loose. And once they become loose, you're going to lose them.
Thank you so much. Oh, sorry. Go ahead, sir. You were saying something, Dr. Ajagbe.
No, I was saying that if you don't do anything about it, the teeth will continue to drift apart and eventually will become loose. and the teeth will be lost.
Thank you. So, again, I want to thank you for a robust session. Dr. Ajay has one more question though. He said, is there any age limit to fixing the open teeth scenario, the one you just talked about?
No, there is no age limit.
Age limit, fantastic.
There is no age limit, and you can use, that's why I say you can use the removable appliance, or you can use what we call the clear aligners, which is Invisalign. If you've heard about Invisalign before, you could use that, or you could use the biomimetics, or the biomimetics, which is also controlling the growth of the hard palate. It will prevent the palate from actually collapsing on itself when you try to close the gap. So it's treatable at any age. It's doable.
Okay, thank
if
you.
Said they can
so much.
Reach out to me. I can talk to them more about it.
Okay, thank you. So, and thanks for that offer. I have a question for you, Miss Cresta Mentor. Do you have any other questions? I'm asking you to unmute.
This is a very simple question. Is gel toothpaste superior to regular toothpaste in terms of scratching the surface of your teeth?
Is what?
The gel toothpaste, is it superior to, let's say, the regular creamy toothpaste?
The toothpaste? The gel toothpaste?
Is it superior?
Dr. O, I heard what she's.
Oh, can you repeat the question first, please? And then.
It's asking if the gel toothpaste is superior to regular creamy white or whatever color.
Right, in terms of if it scratches, like someone told me that gel is better so that I don't scratch up the front of my teeth. Is that a fact?
Because it's
can you ask that question? Can you repeat what she said again, please, sir? We're having difficulty following. Yeah. Okay.
So the question is the gel, tooth gel, for cleaning teeth, like close-up, for instance, in Nigeria? I don't know if close-up is anywhere else in the world, but close-up is kind of like translucent gel compared to Colgate that is opaque white. She's asking, is the gel, the one that is translucent, is it superior to the opaque one, which is whitish because of the abrasive content of the white one versus the gel, right? Is that the question, Cresta?
She said yes.
Okay, so actually, you have to know exactly how the toothpaste were made. Like I said about toothpicks, the manufacturers use psychology. They study people, they try to figure out what do people really want. They give the masses what they want. Some want white with streaks, some don't. But the abrasive content may be the same in both toothpastes. But because one is translucent does not necessarily mean it doesn't have any abrasive content. Because it's part of the thing that they use to constitute their toothpaste, they have to add some powder to their mix. Now, making it to be translucent might be a trade secret, but it does not make it superior to anything. I think I've said it during my previous presentations before that it is not the how expensive or how technologically advanced a particular device or material is. It is how how well it is used. So if you have the gel, for instance, and you use it with medium to bristle toothbrush, you will not have erosion of your teeth. Because I think what you are asking is indirectly talking about wearing off of your teeth. If you're going to use the gel because you think it's not going to wear your teeth, but you are using very hard toothbrush, you are defeating the same purpose that you're trying to avoid by buying the gel. But I can assure you, you have to find out from the manufacturer that they do not put abrasive powder into their gel for you to be able to say definitely is not as abrasive as the one that is opaque. I don't think they are superior to each other. Each manufacturer is marketing just to be able to get a piece of the pie. If their marketing is superior, maybe they make more money, and that's the way it is.
Okay, thank you so very much. So I'm going to defer to Dr. Opeyemi for some closing words. But before I do that, I want to do Medical Mondays moment first. I'm doing things a little bit backwards. You know, we have today as a very, very special day. Today is the birthday of our very own Madam CEO, Madam VP, Lara Okunubi of NAPAC. You know, I know a lot of us here know about NAPAC, the Nigerian American Public Affairs Committee. And she's a mover and shaker, the mother, really, for us all in that organization. She was on a little bit ago, but I think she might have dropped off. But you know, whenever you have the time or you have access, kindly wish her a happy birthday. And we pray that she would continue to celebrate and that our coming years will be way better, richer, more amazing than the years she had spent. So with that being said, Dr. Opeyemi, over to you for some closing remarks. What would you leave with us to take home tonight? Or, yeah, it is tonight, this morning, here in Nigeria.
Mm-hmm. Is he muted?
It's on mute. We can't hear you, Dr. Opeyemi.
Dr. Adewole, are you muted?
It's not muted. It's unmuted, but we cannot hear you. We still can't hear you. Something with your volume. And meanwhile, please, if you look at the chat box, please WhatsApp Madam VP, Madam CEO on her number. It's in the chat box, 301-701-7988. 301.
It's 31.
It's 310.
310, pardon me, 310-701-7988. Thank you, sir. That's 310-701-7988. Kindly send some kind words and well wishes to our madam. So, Dr. Adewole, I'm going to have Dr. Ajagbe conclude. Thank God that's why we have we have big bros like him.
All right, I think
words. You have
okay.
2 minutes.
Thank you all for your patience. This topic has been pretty, it's big. If we can continue on it for a long time. However, the take home here is don't ignore your oral health. Don't ignore any part of your mouth, because if you do, long enough, it's going to go away. And if it goes away, it's going to cost a lot of money to replace. Just like, we hear that somebody is going to have an implant. Implant is not going to be cheap. So to prevent gum disease, you can do the needful. Have a good oral hygiene, maintain excellent home care, good nutrition, and avoidance of bad habits. One of the bad habits is sticking toothpicks, in the mouth all day long, all night long. That's a very bad habit, and it destroys the gum tissue. On the long run, it pushes the gum tissue away to the point where food and bacteria will collect and more bone will be lost. The other thing is anyone who has underlying medical condition that are chronic, like diabetes, like low vitamins, should at least talk to their primary care doctor and get that taken care of, because anyone who has diabetes, for instance, will have very poor healing and they cannot combat infection because the immunity is reduced. So I'm sure if we maintain good oral hygiene and good nutrition and diet and exercise and very good, what we call lifestyle, the chance that the teeth will be there forever. If forever means till death. Thank you.
Thank you so very much. Thank you. And thank you for slightly letting us know that this subject is so huge. And that is why we decided to do it in components, in, bit by bit, because we cannot, discuss everything pertaining to good oral health in one session, not even two. So we will continue next week, because Dr. Adewole just said here, maintain good oral health. How? What is good oral health? All we've talked about today is those toothpicks, which, is an eye opener for me. I learned something new, as I do every Monday. And so by the grace of God, we will continue on oral health next week. And I want us all to remember that our oral health actually affects the heart, every other area of the body, the heart being a huge one. It is important that we take care of this part of our body and guard it jealously. So without belaboring things, I want to say thank you so much for attending Medical Mondays with Dr. O today. I arrived in Lagos earlier today, and so I'll be glad to get some sleep. Have a blessed night. See you next week. And please stay safe. We still have COVID, RSV, monkeypox, flu. We want to believe, flu is over now. It's April, but still, please do be careful. Love you all. Good night.
Thank you.
Thank you.